Hi guys. So after my appointment on Monday, they did decide to admit me. So I'm here at President St. Joseph's Hospital, and I'm getting treatment for my hemiplegic migraines and my vestibular migraines, and my myoclonic jerks, non-epileptic seizures, and things like that. They don't treat my pelvic pain here. That's what Dr. Theophilus does, though they are trying to figure out how to do both. Right now they're trying to keep me off my pelvic pain medicine so that it doesn't interfere with my neurological treatment here. So that's what we're doing. In this video I kind of wanted to give kind of an overview of some things that might be helpful if you would have to stay in the hospital with either a service dog or just stay in the hospital in general. What are some things that would be helpful? Also, if you're wondering what this is behind me, this is my IV. We named him Fabulous Freddy, and we made, my caregiver and I, we made a bow tie out of some napkins and washi tape and a paper straw holder and some IV tape. So, just to make it a little bit more fun. And then I got my PICC line put in yesterday, so that helps so that the medication doesn't burn and doesn't blow any IVs. I had an IV line put in here. PICC line basically means that it's not as subdural in the vein, and it goes straight to your heart, so meds go in faster, it doesn't hurt your veins, and it lasts a bit longer. It won't be going home with me as far as I know, so it just helps make the process a little bit smoother. Ollie is here with me. My caregiver, Sally, she's staying with me. She's taking him outside on a potty break right now, so that's why he's not with me in the video. He might come back in a little bit, so, and he's done really well. The only issue we've had with him, he still is struggling with barking as soon as the door opens, and it's not like continuous barking, it's just like one or two barks, but still, that really can bother some of the other patients, and I feel really bad about that. So that's something I'm still trying to work on. So that's just something to keep in mind. But anyway, here's some things that might be helpful for you and your service dog staying in the hospital. So for your service dog staying in a hospital, here's some things you will definitely need to pack. Is obviously, food and water, bowls. You can use like some of like the puke bins if you want. So that way you can throw away the bowls at the end, or you can bring your own from home. Bring some toys maybe, that way at the end of a day they can have time to get some of that, because they're on duty all day, and that way at the end of the day they can get all that energy out and relax and have a little bit of chill time. Try to bring like a blanket or a mat or something that they can lay down on. Right now I have a mat for Ollie to lay on right here, which I got from Walmart. It was about $25, but it can be machine washable, it's foldable, and that way I can say go to your spot and he knows right where his spot is, and it helps him have a little bed and he doesn't have to lay on the floor or constantly on my bed. The next thing you want to bring is his harness. This is just to alert other people that he is a service dog or a working dog, and that it's not just a pet. If he is an ESA dog, you are going to need your paperwork for that. Service dogs do not, as far as I'm aware of, but it does help to have a harness just to alert people and know, and that way kind of helps keep everyone in the loop. Also, you want to make sure that you have your leash and collar, because they always have to be on leash all the time in the hospital. That is a must. It's also very helpful to have your vaccination list, and they have to be kept up to date with all their vaccinations and shots. So keeping that in the hospital with them as well, just in case if worst case scenario something happens, you have that ready and you can show them that everything's good. This is what's here, you know, we're all good. Brushes are a good thing to keep. Another thing I like to bring is Pepto-Bismol chewable tablets. And you might be thinking, like, why for your dog? Well, sometimes plane flights can make him a little bit nauseous. So, I will crush up some Pepto-Bismol if he is getting tummy sick afterwards. I won't do it as a preventative, but if he is already sick to his stomach, then I will give him Pepto-Bismol and tell him. Because you don't, the last thing you want is to be stuck in the hospital and have your dog be throwing up. So I have that just in case as an emergency, and it is safe to give for your dog. One of those. Obviously, you want to make sure to check with your vet that it's okay. My vet has cleared Ollie to be able to have one Pepto-Bismol tablet. I also like to use like a cologne spray for him, and just in case, like, just for smell-wise, to keep him smelling nice. You can do like a shampoo wash if you wanted to. I doubt you'd be wanting to wash him in the hospital, but that's up to you. Poop bags are definitely things you want to bring for outside use so that you can pick up his poop afterwards, and you don't leave it on the grass, just to be polite for other people. And then a door sign. This is very helpful, especially if your dog is triggered by knocking, just to be like, knock softly, service dog inside. That way the person knows, okay, there's a service dog inside, and that way they're not startled if they see them. And so that's kind of an overall that I brought. Another thing I bring for Ollie is like some bones, treats, his food, and CBD oil. The CBD oil just helps keep him calm. I use it sparingly, but that's there just in case. But that's kind of what I bring for Ollie, and seems to help us. So, what should you bring for you as the patient? Well, something I found helpful is a fuzzy blanket. They're very nice because hospital blankets tend to be thin, so if you're usually a cold person or usually tend to get cold easy, fuzzy blankets are very nice. So I have this fuzzy blanket, super big, super soft. That's really nice to have in the hospital. An eye mask is really nice so that you can, because nurses will be coming in and out all the time, you can keep the eye mask on, keeps out light and all that. Lotion is really nice because usually it's drier in hospitals, so I usually like to keep like a bottle of lotion at my bedside just in case. I also like keeping a essential oil diffuser going right in the background there. And that's nice just to kind of make it a little bit more homey, and also it helps with like my nausea and headaches and things like that. Just makes it smell nice. Also, if I can't sleep, I put in lavender. It just makes it really nice. Chapstick, also for dryness. I like using chapstick. Fuzzy pants. I love wearing fuzzy pants. Pajamas, because it depends on which hospital you're in, but in President St. Joseph's, I'm allowed to wear pajamas. If you are in another hospital, they may only allow you to wear like a gown and then pants. Oh, Ollie and Sally are back.
Hello. Looks like she's gonna do some work on you, so I'm gonna take him down. Hello.
Sally just got back with Ollie, taking him outside. She's been really helpful with just taking him on walks because I'm not allowed to leave my hall. Like I said, if some hospitals, they don't allow you to wear like regular pajamas, and so you may only be allowed to wear fuzzy pants, so having like pajama pants is really nice. Beanies. I love my beanies like so much. That's another thing that's really nice to kind of make it feel like a little bit home. I don't know why, I just find beanies really comforting, so I wear beanies all the time. Another thing, super important and helpful, slippers, or fuzzy socks with, make sure that they have like little stickies on the bottom, because that will definitely help you. They won't let you wear regular fuzzy socks like just around the hospital itself because you could slip and fall, but they have stickies on the bottom, you can wear them. And that really helps because some hospital socks can be itchy on the inside, and that way you can wear them anywhere you want, and it helps with the risk of falling. So that is really nice, and I like that a lot. I always make sure I pack my fuzzy socks with stickies and slippers. Ponytail holders is really nice just to put your hair back, especially if I get nauseous. You can pack some nice pillows. I like their pillows here, so it's kind of a preference thing. Heating pad, for me, is definitely a must. I have to have my heating pad. A lot of the heating pads in hospitals are water-based, and they don't get as hot as I need them for myself. So I need a heating pad. Let's see. I also like to bring non-metal jewelry like this. It's plastic. The reason being non-metal, you can wear it in scans and like through MRIs and CAT scans and things like that without having to take it on and off. That also helps to feel comforting. It has something of home, and you can kind of add style to your outfit without having to take it on and off for scans. Something that you can bring with you if you're nervous, you can fiddle around with if you're anxious during a scan. I really like that. They wouldn't let you doing that during surgery, but it's something that you can wear during a scan that's really nice. I found helpful. Shower caddies are really nice. That way you have something to put right in your shower next to it to keep all your stuff together in one place, right next to your shower. Just reach in, grab it, and go. Another thing, obviously your laptop, iPad, iPhone, things like that, just to keep yourself active, busy, entertain yourself if you have to be stuck in your room. That's really nice, especially if there's nothing good on TV. If you also want to commit. Sorry, that was someone taking away my tray from breakfast this morning. So, another thing, if you want to, this is totally, again, preference. I like to paint my nails in the hospital, except here on neurological floor you can't because of the smell, and a lot of people have headaches from brain issues, so I can't. But that's something you can bring with you if you like, and your hospital allows you to do that. I like to do that in the hospital sometimes, just paint my nails, have a girls' night. Sunglasses is really nice. Because sometimes you're facing a window and the light is like blinding you. It has no like blinds that won't come down all the way, and it's really aggravating. So definitely sunglasses is a must. Your obvious shampoo, conditioner, soap, etc. Your normal toiletry products. A coloring book or a sketch pad is always really nice to keep yourself busy and to just kind of chill and relax. A stress ball is really nice, just to kind of, if you're in a lot of pain, to kind of just get that tension out. I like bringing a digital clock or watch. That way, because I can tend to get a little disoriented in the hospital because I lose track of time, and granted, there's a clock up there, but sometimes a digital clock, especially at night, is just easier to see. So that's what I have over there. It's just a digital clock sitting up there so I can see it, and that makes it easier to just, know the time. Tissues are a really nice thing to bring because a lot of the tissues here are these, like your school tissues, and they're a little rough. I mean, it works well, but again, they're a little rough, so it's not the nicest quality of tissues, so it can irritate your nose, especially if you're blowing your nose a lot. So bring some nice, just a little packet of nice tissues just in case you get like a cold and have to be blowing your nose a lot. Chargers, headphones, noise canceling headphones are awesome, especially if you are right next to a nurse's station. It's amazing. Cordless headphones are really nice if you have like IVs, and that way your cord of your headphones doesn't get all tangled up with your IV pole. Flip-flops are really nice for in the shower if you want to use that. And then if you get cold, I usually suggest zip-up hoodies instead of pullover hoodies because that makes it easier with the IVs getting it in and out. That way if you need to take off one arm, put it in and out, it makes it easier that way. face moisturizer. Again, I don't know if it's just me, but I get super dried out in the hospital, so I always get like face moisturizer, chapstick, lotion. I soak up my skin. And then last thing, for entertainment purposes thing wise, is knitting. I don't know if you're a big knitter or whatever, but I like to knit. Loom knitting is super easy to do, and that's something I found helpful. So that's just some things I like to bring to the hospital. If you have any suggestions of things that have helped you in the past, please write them down in the comments below. I'd love to hear them and hear your suggestions, and any ideas that you might have. And I will try to keep you guys posted on everything that happens here. And hopefully I'll be able to see some progress and get some good improvement. So, and I'll keep you guys posted. But until then, I hope you guys all stay chronically strong. Love you all. Bye.